Compromised circulation destroys lives without making a sound. Every single night, millions of adults over 60 are lying in positions that place unnecessary strain on their hearts, silently encourage dangerous blood clots to form, and quietly lay the groundwork for a stroke that could arrive without warning. But here is the truth that nobody is putting in front of you. One straightforward adjustment to the way you position your body during sleep, or can slash your stroke risk by more than 1/3. I am a cardiologist, and what I am about to share with you is information I genuinely wish every single one of my patients had possessed. 20 years before they ever sat across from me. Right now, there exists one specific sleep position that actively works against the blood clots forming silently inside your veins while you are unconscious. One position that removes real, measurable pressure from your heart during every hour of every night. And virtually nobody is sleeping in it. Not because it is complicated, not because it demands expensive equipment, but because nobody, not your primary care physician, not your cardiologist, not the person who guided you toward your mattress, has ever sat you down and told you the unvarnished truth about what your sleeping position is doing to your cardiovascular system night after night after night. That changes right now. Stay informed, stay rational, take your health seriously. The complete answer fits inside a single sentence. But that sentence requires the science supporting it, or you will not believe it, with enough conviction to actually act. So I need you to remain with me through to the end, because the position itself, the complete science, the precise setup, and the exact biological reason it produces results, I am going to deliver all of it, but only after I show you what is currently happening inside your body while you sleep. The science is what makes this information impossible to set aside. And the science begins now. My name is Dr. Stanley Brown. 18 years devoted specifically to cardiovascular health and stroke prevention in adults over 60. Over 3,000 patients through my practice. And what I kept uncovering in those examination rooms fundamentally altered the way I approach medicine. Patient after patient. Individuals who were compliant with their medications, who walked every morning without fail, who genuinely did everything their doctors recommended, were still experiencing strokes, still developing life-threatening blood clots. The answer I kept arriving at had nothing to do with their diet, nothing to do with their prescriptions. It was their sleep position. I need to say something directly before we continue. The pharmaceutical industry generates profit when you remain on blood thinners indefinitely. The mattress industry generates profit when you blame your bed rather than examining how you lie in it. Neither of those industries benefits from you watching this video today. I am not here to sell you a single thing. I am here because every adult over 60 deserves to understand what is happening to their heart during the hours they are most vulnerable. You spend 1/3 of your entire existence unconscious. During those hours, you have zero conscious influence over your cardiovascular system. Your heart contracts 60 to 70 times per minute, every minute, without interruption, all night long. Your veins are simultaneously working to push blood from your legs all the way back up to your heart, against gravity, through vessel walls that have progressively lost their elasticity and muscular tone over the decades. After 60, your body manufactures dramatically less nitric oxide, the compound responsible for keeping your arteries relaxed and your blood moving smoothly and efficiently. Nitric oxide production decreases by nearly half after 60. Half. That is your body's primary vessel-relaxing mechanism operating at 50% capacity during the very hours when your cardiovascular system most needs support. Tighter vessels, slower blood movement, greater resistance, every single night, and blood that moves slowly and pools in one location does one thing above all others. It forms clots. Deep vein thrombosis occurs 3 times more frequently in adults over 60 than in younger populations. When a clot detaches, it travels through your venous system, into your heart, into your lungs, into the vessels supplying your brain. That sequence of events is a stroke. Research published in the Journal of Clinical Sleep Medicine documented that 72% of all strokes occur either during sleep or within the first 60 minutes following waking. The most cardiovascularly dangerous hours of your entire day are the hours you spend lying in your bed. Do you wake up with swollen ankles that were not swollen when you went to sleep? Do you climb out of bed feeling more exhausted than when you climbed in? Do your legs carry a heaviness that requires an hour of movement before it dissipates? Type yes in the comments right now if any of those descriptions match your experience. Those are not unrelated or unexplained symptoms. Those are the physical fingerprints of circulation that is being systematically compromised during your sleeping hours. Later in this video, I will walk you through a 15-minute pre-sleep routine that drains that pooled blood before you lie down for the night. The data behind it genuinely surprised me when I first encountered it. Your heart sits slightly left of your body's center line. Your aorta, the largest and most critical artery in your body, curves leftward and downward as it exits the heart. When you sleep on your right side, you create a bend in that aorta, functioning mechanically like a kink developing in a garden hose under pressure. Blood flow becomes measurably less efficient. Research published in the Journal of Clinical Cardiology found that sleeping on the right side increased nighttime cardiac palpitations by 28% in adults over 65, not from any structural pathology, from purely mechanical pressure that had no business being there. I want to tell you about one of my patients, a 71-year-old retired schoolteacher from Ohio. She came to my office after nearly a year of waking between 3 and 4 in the morning with her heart racing. Rapid, irregular, deeply frightening. She had undergone an EKG, a Holter monitor, an echocardiogram, and a stress test. Every result returned normal. Her cardiologist attributed it to anxiety. Her general practitioner told her to eliminate caffeine. She came to me as a last resort after exhausting every other avenue. I asked her one question that none of the other physicians had thought to ask. Which side do you sleep on? Her answer was immediate and certain. Always her right side, her entire life, without exception. I suggested a simple 2-week trial of sleeping on her left side instead. 3 weeks after that conversation, she called my office. The palpitations had vanished completely. She was sleeping through the entire night for the first time in a year. This was not a medical miracle. This was human anatomy performing precisely as anatomy is designed to perform when you stop positioning your body in direct opposition to its own mechanical preferences. Now I need to walk you through the 3 sleeping positions that are silently damaging hearts every single night across this country. There is a significant probability that you are currently sleeping in one of them. Understanding the specific damage each one creates is what makes the solution not just convincing, but permanently unforgettable. The worst offender first. Stomach sleeping is the single most cardiovascularly destructive position an adult over 60 can occupy for 8 hours. Your chest cavity is compressed directly against the mattress surface. Your heart is being squeezed from outside while simultaneously working to pump from inside. A study published in the Journal of Applied Physiology documented that stomach sleeping reduced cardiac output by 23% and increased left ventricular workload by 18%. Every heartbeat working harder than physiologically necessary for 8 continuous hours. Sustained over months and years, that accumulating demand progressively weakens the heart muscle itself. Additionally, the head rotation required to breathe while lying face down compresses the arteries supplying your brain. A mechanical compromise linked to a 41% elevated stroke risk. Flat back sleeping appears neutral from the outside, but the interior reality is significantly more threatening. It produces a 67% increase in sleep apnea events in adults over 60. Every episode where breathing stops triggers a crash in blood oxygen saturation, a spike in blood pressure, and direct damage to vessel walls. A 2021 study conducted by the New England Journal of Medicine Following 14,000 older adults found that flatback sleepers experienced cardiovascular events at a rate 39% higher than their counterparts. I am aware of what some of you are thinking right now. You have slept this way for your entire adult life. If it were genuinely dangerous, you would know by now. But the damage accumulated from sleeping in the wrong position does not announce its presence. It builds quietly, invisibly, over years, until one morning the announcement arrives in the form of a stroke, a blood clot lodged somewhere critical, or a heart muscle that has spent a decade working harder than it ever needed to. That is precisely why this conversation is worth having. Sleeping on the right side introduces two additional mechanisms of harm. Your liver is positioned directly beneath your heart when you sleep on your right, generating upward mechanical pressure that reduces the completeness with which your heart fills on each beat. And your lymphatic system, which is responsible for clearing inflammatory waste products from your tissues, drains primarily along the left side of your body. Sleeping on your right actively opposes that drainage. Inflammatory waste accumulates in your tissues, and chronic systemic inflammation is a primary driver of arterial plaque formation, blood vessel deterioration, and stroke. 3 positions. 3 distinct mechanisms of silent cardiovascular damage. Everything I have described: the aortic curve mechanics, the lymphatic drainage pathway, the venous return dynamics, the nitric oxide deficit, the clot formation conditions. Every single piece of that evidence points in precisely the same direction. Your body has a preferred side. It has always had a preferred side. It was built with that preference encoded into its anatomy before you drew your first breath. And the moment I tell you which side that is, everything I have said will immediately make sense. Not as new information, but as something that was always obvious when someone finally said it aloud. Sleep on your left side. That is the position. Left side, sleeping with the specific elevation setup I am about to walk you through in complete detail. And the reason it produces results is written directly into your anatomical architecture. When you sleep on your left side, gravity actively assists your heart rather than working against it. Your aorta carries blood in the natural direction of its own curvature. A study published in the Journal of the American College of Cardiology found that left-side sleeping improved cardiac output efficiency by 17% compared to right-side sleeping, the difference between a heart working hard and a heart working intelligently. Your lymphatic system drains inflammatory waste from your tissues more effectively. Less systemic inflammation translates directly to reduced plaque formation, lower clot risk, and meaningfully lower stroke probability. A cascade of biological benefit operating automatically in your favor every single night. Left side sleeping additionally reduces acid reflux, which protects your heart's electrical conduction system through its connection with the vagus nerve. If your physician has never mentioned any of this to you, hit subscribe right now. This is precisely the kind of information I bring to adults over 60 every single week on this channel. But left-side sleeping is only the foundational layer of this protocol. What I am about to show you next multiplies every benefit I have just described, and it adds 0 cost. Adding modest upper body elevation of 15 to 20 degrees amplifies the benefits of left-side sleeping substantially. When your upper body is elevated, the pressure gradient relationship between your heart and your brain shifts in your favor. Your heart expends less energy with every beat. Your blood pressure drops the way it is biologically intended to drop during sleep. Most people are entirely unaware of this clinical reality. Your nighttime blood pressure is a more accurate predictor of stroke risk than your daytime blood pressure readings. Your pressure should decrease between 10 and 20% during sleep. Cardiologists refer to this reduction as dipping. If your pressure fails to drop, or worse, if it elevates, you are classified as a non-dipper. Research published in the journal Hypertension established that non-dippers carry 2.5 times the cardiovascular event risk of individuals who dip normally. 2.5 times. Upper body elevation during sleep represents one of the most powerful non-pharmaceutical tools available for restoring healthy nighttime dipping. A study published in Frontiers in Aging Neuroscience followed 9,000 older adults across 6 years. Those who slept with their upper bodies elevated 15 to 20 degrees experienced a 41% lower rate of hemorrhagic stroke and a 36% lower rate of ischemic stroke compared to those sleeping completely flat. Allow me to tell you about another patient, a 74-year-old retired engineer from Pennsylvania. For 3 consecutive years, his physician had been managing dangerous nighttime blood pressure spikes with 2 separate medications. His readings remained inadequately controlled despite the pharmaceutical intervention. What he did not volunteer when he first arrived at my office was the fear he had been carrying, not the kind men of his generation express easily or directly. He would lie awake some nights watching the clock progress through the small hours, wondering quietly whether tonight would be the night something catastrophic happened. His wife had relocated to their guest bedroom months earlier. The house had grown quieter than it should have been, he told me, in a way that carried more weight than the words themselves. I explained the concept of non-dipping. I explained the mechanics of upper body elevation. He elevated his bed frame using simple, inexpensive bed risers. 6 weeks later, his average nighttime blood pressure had dropped 19 points. His cardiologist reduced one of his 2 medications. His wife returned to their bedroom. He sat across from me and said, 3 years of pills, 1 conversation with you, then I wish someone had told me this earlier. So do I. This was not medical magic. This was the application of physics to a human body operating every night under conditions it was never designed to tolerate. Now, let me give you the complete setup in precise detail. And before I deliver your action plan, I need to walk you through 3 critical mistakes that will render this entire protocol completely ineffective if you commit them. I have watched all 3 systematically eliminate results for patients who were otherwise doing nearly everything correctly. But first, the exact setup. Every element serves a specific physiological purpose. Do not omit any of them. Element 1, upper body elevation. Your entire upper body elevated between 15 and 20 degrees. Not exclusively your head, your entire upper body from the shoulders upward. Accomplish this using a foam wedge pillow or by placing bed risers beneath the legs of your bed frame at the head end. The head of your bed should sit approximately 7 to 9 inches higher than the foot end. Do not exceed 25 degrees. Beyond that threshold, you begin sliding gradually during the night and generating lower back strain that compounds through the hours. Element 2, the knee pillow. Place a firm pillow positioned between your knees. Without this support, your uppermost leg progressively pulls your pelvis forward during the night, compressing the major blood vessels running through your groin and upper thigh. Compressed vessels mean reduced blood delivery to your entire lower body throughout the night. The knee pillow keeps your hips properly stacked, your vessels unobstructed, and your blood moving as it should. Element 3. Rib cage support. Position a small pillow or a firmly rolled towel beneath your left rib cage just below the armpit line. This serves 2 functions simultaneously. It removes accumulated pressure from your left shoulder, and it prevents your body from rolling backward onto your back during the night. It maintains your position without generating discomfort that builds and wakes you through the hours. Element 4. Head pillow height. And this is where I must tell you about another patient because she made the precise mistake most people make when attempting to implement this protocol independently. A 78-year-old retired nurse from Tennessee. 3 separate physicians had dismissed her presenting symptom. Every single morning, without a single exception, she woke with a throbbing headache concentrated behind her eyes. 2 hours and 2 pain relievers required before it resolved. Mental fog persisting until nearly midday. She was told dehydration. She was told blood pressure fluctuation. She was told this is simply aging. As someone who had practiced nursing for 40 years, she understood with quiet certainty that something was being overlooked. She had been sleeping on a wedge pillow with two thick standard pillows stacked on top of it. Her head was elevated at nearly 40 degrees. At that angle, the carotid arteries on both sides of her neck undergo partial compression for 8 continuous hours, producing chronic overnight reduction in blood delivery to her brain. 5 weeks after correcting the elevation angle, she walked into my examination room, and before she had taken her seat, she said, "The headaches are gone." I wake up with clarity. My daughter says I seem like myself again. There were tears in her eyes when she said it. This was not complicated clinical medicine. This was attending carefully to the fundamental mechanics that everyone with credentials had overlooked. Your head pillow must maintain your spine in a straight neutral alignment from the base of your neck to your tailbone while lying on your side. Medium thickness serves most people adequately. Test it by feel. A straight, unbroken line from neck to tailbone is your correct height. That is your only benchmark. I want to pause here for just a moment because I am aware some of you are feeling the weight of absorbing all of these components simultaneously. Stay with me for 3 more minutes because what follows is the element that integrates everything, and the research behind it genuinely caught me by surprise when I first encountered it. Throughout your waking hours, blood and interstitial fluid accumulate progressively in your lower legs and feet. By the time you prepare for bed, your legs are carrying a fluid burden that your cardiovascular system must then manage and redistribute across the entire night. When you lie down, that pooled blood rushes back toward the heart in a relatively sudden volume shift. Your kidneys respond to the increased central fluid load by producing urine, which explains precisely why so many adults over 60 wake 2 or 3 times every night to use the bathroom. In the majority of those cases, that is not a bladder capacity problem. That is a fluid distribution problem resolving itself at the most inconvenient possible hour. Here is the pre-sleep drainage protocol. 30 to 60 minutes before your intended sleep time, lie on your back with both legs elevated above the level of your heart. Pillows, a wedge, feet resting against the wall, any configuration that achieves the elevation works. Hold that position for 15 minutes. Gravity redirects the venous blood pooled in your legs back toward your heart and kidneys before you sleep rather than during it. Research published in the Journal of Vascular Surgery found this single practice reduced overnight venous pooling by 44% and produced measurable reductions in circulating clotting factors in the blood. And a 2023 study that combined all of these elements together, left side sleeping, upper body elevation, correct pillow positioning, and pre-sleep leg elevation, found that the complete integrated protocol reduced overall cardiovascular event risk, including stroke and pulmonary embolism, by 43% across a 3-year follow-up period. 43%. Not from a prescription medication, not from a surgical intervention, from the position and preparation of your body during sleep. I want to tell you about one more patient. You do not need to have survived a stroke or a blood clot to understand what he was living with. You only need to have lain awake in the dark, wondering quietly whether tonight might be the night something goes wrong. If that experience is familiar to you, you will understand him completely. A 69-year-old retired police officer from Georgia. He had survived a pulmonary embolism, a clot that had traveled from his leg into his lung. 18 months before arriving at my practice, he was on blood thinners and under active monitoring. But genuine restorative sleep had become impossible. Every time he closed his eyes, some part of his nervous system remained alert, listening for something he could not identify, afraid that the next clot was already forming somewhere beyond his awareness. His physicians had treated the clot with appropriate clinical competence. Nobody had addressed the conditions that had contributed to its formation in the first place. I walked him through the complete protocol in precise detail. Left side positioning, upper body elevation, the full pillow setup, pre-sleep leg drainage, every element without exception. 8 weeks later, he arrived at my office looking visibly different, lighter in a way that had nothing to do with his weight. He said, "Dr. Stanley Brown, for the first time since the embolism, I am not afraid to go to sleep." His blood thinner dosage had been reviewed and reduced at his most recent hematology appointment. The morning leg swelling that had persisted since the embolism had resolved. He was sleeping through the night undisturbed. He said, "I thought I simply had to learn to live with the fear. I did not know there was something concrete I could actually do." This was not a miracle. This was a body finally receiving the physiological conditions it required to stop working against itself during every sleeping hour. That is the reason these videos exist, because there are thousands of people like him, like the nurse from Tennessee, like the engineer from Pennsylvania, like the schoolteacher from Ohio, people who have been told their symptoms are simply the inevitable price of aging. People who do not yet know that some of the most powerful cardiovascular protection available requires no prescription, costs almost nothing, and can begin tonight. 3 mistakes I see repeatedly that will systematically destroy your results. Mistake 1. Using standard pillows for upper body elevation. They compress progressively during the night. You begin elevated and wake up flat, with disrupted sleep and zero cardiovascular benefit. Use a properly constructed foam wedge or rigid bed risers. They maintain their angle consistently across the entire night. Mistake 2. Elevating only your head. Stacking pillows behind your head while your torso remains flat creates neck compression, not therapeutic elevation. You feel as though you are implementing the protocol correctly, so you stop searching for the actual solution. Your entire torso must be elevated from below the shoulder line. Mistake 3. Attempting to implement every element simultaneously on the first night. Habits with decades of history behind them require gradual, systematic replacement. Introduce one element every 3 nights. Within 2 weeks, every component feels entirely natural, and your body is receiving 8 hours of cardiovascular support rather than 8 hours of unnecessary mechanical strain. Starting tonight, sleep on your left side, place a pillow between your knees, use 2 or 3 firm pillows to create some degree of upper body elevation, and spend 10 to 15 minutes before bed with your feet elevated above your heart level. Sofa armrest, wall, pillow stack, any version that achieves the elevation is sufficient. This week, order a foam wedge pillow or a set of bed risers. $40 to $70. Less than a single specialist copayment, effective every single night for years. Once your equipment arrives, implement the complete setup. Left side positioning, 15 to 20 degrees of upper body elevation, knee pillow, rib cage support pillow, head pillow set to neutral spine alignment, pre-sleep leg elevation every night without exception. Track your morning ankle swelling, your mental clarity upon waking, the number of overnight bathroom trips, and your energy level in the first hour of the morning. And I want you to make one specific commitment right now. 30 days, 30 nights on your left side with this complete protocol in place. Return to this video in 30 days and tell me in the comments what changed. I will be reading every single response personally. I recognize that sounds like a great deal to hold in mind simultaneously. It is not. On the first night, it is 3 things only. Left side, pillow between your knees, legs elevated for 15 minutes before you lie down. That is sufficient to begin. That is enough to initiate a meaningful change in what has been occurring inside your cardiovascular system, possibly for years. Everything else builds naturally from that foundation. But before I let you go, there is one more thing I need to say, and it may carry more weight than anything else in this entire video. You are not broken. I know that some of you have been told by physicians, by specialists, perhaps by members of your own family, that what you are experiencing is simply what getting older looks like. That the swelling, the fatigue, the palpitations, the poor sleep quality, that is simply what 70 feels like. That is the price attached to the years. I am telling you as directly and clearly as I am capable of. That is not the complete truth. A significant portion of what you have accepted as biologically inevitable is actually mechanical in nature, and mechanical problems yield to mechanical solutions. Your heart has not surrendered. Your body has not surrendered. It is working right now with every resource available to it to keep you here and keep you functioning. It simply requires the right conditions to operate as it was designed to operate. You spent decades constructing the habits that brought you to where you stand today. You are capable of building new ones, not because it will be effortless, but because the alternative, spending another night in a position that strains your heart and actively feeds the conditions for stroke and clot formation, is no longer something you are willing to accept. Not now that you understand what is at stake. The position you sleep in tonight will either support your cardiovascular system or place additional stress upon it. That choice has always belonged to you. You simply lacked the information required to make it consciously and deliberately. Now you have that information. Begin tonight, even imperfectly, left side, knees supported, upper body slightly elevated, legs drained before you lie down. That is sufficient. Your heart will register the difference before your conscious mind does. Trust the process. Trust your body. It has been waiting for exactly this. If this video delivered something genuinely valuable, something your physician has not told you, something that meaningfully changes how you approach the next 8 hours of your life, I have one request. Share it. Think of one specific person in your life who has experienced a stroke, who takes blood pressure medication daily, who wakes every morning with swollen legs without understanding why. One click is all it requires to place this information directly in front of them. You might be giving them something that produces a change in their health that nothing else has managed to achieve. The people who stand to benefit most from this video may never encounter it independently, but you can send it to them right now. If you are new to this channel, subscribe. Every week I bring you precise, honest, evidence-based cardiovascular health information developed specifically for adults over 60. No products, no hidden agenda. Simply the science and what it genuinely means for the way you live your daily life. These videos are not funded by pharmaceutical companies or the supplement industry, which means everything shared here is driven by one thing exclusively: what the clinical evidence actually demonstrates. Subscribe so you do not miss what is coming next. Before you go, I want to hear from you in the comments. Which sleep position have you been in? What specific change are you committing to make tonight? And remember, return in 30 days and tell me what happened. I will be reading every single response. If you have personally experienced a stroke, a TIA, a blood clot, or a cardiac event, your story belongs in this space. Share it. Someone is watching this video right now who needs to know they are not facing this alone. Your experience may be precisely the thing that gives them the courage to make a change they have been delaying. I read every comment personally because every person who finds this video matters to me. Not as a viewer, but as a patient. Sleep well tonight. For the first time, you know exactly how.